Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen to the audio. Complete the answers as you listen to the audio. Now look at question 25. You hear a physician explaining to his staff about azotemia. Now read the question.
Hello, doctor. Can you please explain azotemia to me?
Azotemia is a kind of nephrotoxicity that occurs when there's nitrogen in our blood. Uremia occurs when there's urine in your blood. When excess nitrogen becomes toxic to our system and results in uremia or uremic syndrome. If untreated, azotemia can lead to acute renal failure. When fluid isn't flowing enough through the kidneys, prerenal azotemia occurs, creating high levels of urea and serum creatine concentration. This is the most common type of azotemia and can be reversed. Usually, intrinsic azotemia is caused due to sepsis, infection, or disease. Acute tubular necrosis is the most common type of intrinsic azotemia. Postrenal azotemia is caused by an obstruction in the urinary tract. Postrenal azotemia can also occur with prerenal azotemia. Question 26. You hear a physician explaining to her nurse about bilirubin blood level. Now read the question.
Hello, doctor. What is a bilirubin blood level?
As a result of breakdown of red blood cells, bilirubin is released into the blood. Bilirubin is used by the liver to make bile. Generally, a small amount of bilirubin is present in the blood. The increased level of bilirubin in blood could be a symptom of a liver or blood problem. A common cause of increased bilirubin is Gilbert syndrome, a deficiency in an enzyme. As the bilirubin levels in the blood get higher, the white part of our eyes, called sclerae, may turn yellow. Also, our skin may appear yellowish. This is called icterus or jaundice. Question 27. You hear a physician explaining to her nurse about celiac disease. Now read the question.
Hello, doctor. Who really has celiac disease and who doesn't?
Well, according to findings, about 40% of people worldwide may have a genetic susceptibility to develop celiac disease, where they react to gluten in their diet. However, what I feel is about 1% develop celiac disease. Those people do very well on a gluten-free diet, avoid wheat, oats, and rye. However, gluten is very tough to digest, therefore it's very gassy. So I think people who buy gluten-free foods are really avoiding gassiness. But I think most people are not really bothered by gluten. A simple blood test can help identify those with celiac disease. But simply avoiding foods to get rid of celiac disease is well worth continuing. Question 28. You hear a physician briefing his junior staff about precision medicine. Now read the question.
Precision medicine is an emerging strategy for disease treatment based on the individual variability in genes, environment, and the lifestyle of each patient, allowing healthcare professionals and researchers to deliver precise treatment strategies for specific diseases in specific types of patients. It is in contrary to a one-size-fits-all approach, in which general treatment strategies are followed, with less consideration for the differences between patients. Although the term precision medicine may be relatively new, the concept has been a part of healthcare for many years. For instance, a person who requires a blood transfusion is not given blood from a randomly selected donor. Instead, the donor's blood type is matched to the patient to reduce the risk of complications. However, the role of the precision medicine in patient treatment is relatively limited.
Question 29. You hear a physician briefing her junior staff about alopecia areata. Now read the question. In most people with alopecia areata, hair falls out in small, round patches, leaving round-shaped areas of bare skin. Often, this patchy hair loss occurs on the scalp. However, it can affect other parts of the body as well. Rarely, the hair loss involves the entire scalp, a condition called alopecia totalis, or else, even the whole body becomes hairless, a condition called alopecia universalis. There are also other forms of alopecia areata that occur very rarely, which have different patterns of hair loss. However, the hair usually grows back after several months, though it may fall out again. Question 30. You hear a physician briefing a junior staff about cytochrome C oxidase deficiency. Now read the question. A genetic condition called cytochrome C oxidase deficiency affects several parts of the body, including the skeletal muscles, the brain, the heart, or the liver. Usually the symptoms and signs begin before 2 years of age, however appear at a later stage in mildly affected individuals. The severity of the disease varies widely among affected patients, even among those who belong to the same family. Patients with mild cytochrome C oxidase deficiency tend to have myopathy and hypotonia with no other related health issues. More severely affected patients have problems in multiple body systems, including encephalomyopathy, hypertrophic cardiomyopathy. Another possible feature of this condition is an enlarged liver called hepatomegaly that may result in liver failure. Many patients with cytochrome C oxidase deficiency have a specific group of features known as Leigh syndrome that include movement problems, loss of mental function, eating difficulties, hypertrophic cardiomyopathy, and brain abnormalities.